So this is Magnum. I knew him on the racetrack, and he's not very old. He's about 4 now, coming up to 4 now. And anyway, he was a consistent horse. He always did very well. And anyway, he bowed, and not uncommon on the track or even in, you know, sort of sports, whether it be barrel racing or eventing. Anyway, as you can see where it's bowed here, and at the time, you know, the traditional way of treating a bow tendon would be to just put the horse out. Some people might even consider this one too extreme, but normally a racehorse would probably have almost a year off, and they'd wait for the scar tissue to form in there so that, you know, it would heal that way. Unfortunately, when you get a lot of scar tissue, then what happens is 72% of racehorses will go out and rebow again. So I decided to take this one on as my charity case. I persuaded a good friend to give him a home. She was a little bit nervous. And I worked on him every day for the first month. Well, minimum 5 times a week for the first month. And then we went down to 3 times a week. And this went on for 8 weeks before I actually went back to Canada. And in that time, he never took a lame step. And Susan was back, he bowed March, and she was back loping on him by May. And so anyway, what we did, we employed a few different methods. We used the laser, which we'll go into the protocols in a moment. We also used a magnetic boot, because we tried to make him aware of his leg, because he was, as you see, a bit of a rambunctious child. We tried giving him stall rest, that didn't work. We tried putting webbing across, that didn't work. He was a bit of an escape artist. And we also used an egg bar shoe, because he needed extra support. I would recommend keeping shoes on for a bow. It's all about stability. I come from a long line of farriers, and so I consulted with them, you know, before we actually started treating Magnum. As with all my treatments, I start with, you know, doing the unwind. However, when this bow was at its worst, I didn't give him a lot of pain relief, because he was so hot when he came off the track. I didn't want him to feel too good. I wanted him to be aware that he was injured. So he came off all his hot food, and we tried to keep him in a very quiet, calm area. And so I gave him some pain relief. He was never on bute. It was only laser, because we needed to know the effects. This is when I wanted to know if the ActiVet really worked. This was my trial child. And then what I did is that I'd give him a little bit, but and just enough to sort of calm him down, but not enough to make him feel like a racehorse again. So I also treated, as well as the bow, I treated the opposite leg, just again because I was concerned that because of the compensation and the weight, that we might even end up with abscesses on that side. Now with this particular bow, I didn't get an opportunity to see the ultrasound, so I used thermal imaging to help guide me to where the tear was. So using setting 5, I started from here and I'd work down. The actual tear was in here according to the thermal imaging. So this is, I worked in this area using the scan method. Some days I did use the spot method just to make sure I was getting all of those areas. So I'd use 5 on either side. So it's right through either side. Again, if you're using spots and you're going like here, then when you do go from the front, you go in between here, so that you're actually catching the area. So I would use then 2, and I'd work all the way down. The tear's here, but for good measure, I just start above, on it, and below it. And that's pretty much my little motto. It's like you work above it, on it, and below it. And then what I did, I went right underneath here. It wasn't just the tear, right underneath here. And then for good measure, just because I had the time, I used the 1 on the front, again from the knee down. So there's a poor circulation in this area, so everything helped. And then, like I said, we use an egg bar to help support this, and we use a magnetic boot to also keep stimulating that circulation. And we use magnetic boots on both legs.
My name is Susan Zumalin. I'm the owner of Rebar Ranch. We rehabilitate and retrain and recycle racehorses off the racetrack. Magnum is a horse that is very dear to my heart. He was looking at, or I was looking at, a long-term and possibly a forever home in my backyard. But with the therapy and how fast it healed, it made me aware of the possibilities and let Magnum know his possibilities as far as going into a recycled and a more permanent home. Magnum, we suspected, had not only one bow, but we suspected had two. It was probably the most significant bow in my career that I have ever seen. When he first came to me, he was unable to walk. I was looking at the possibility of a 1 year to 1.5 years rehabilitation time, and we decided to go ahead and implement a therapy program that would be the least invasive and the fastest healing to where I can get back onto my program. Lisa came out and use the ActiVet laser on Magnum between 4 and 6 times a week, and the outcome was amazing. The first 2 weeks we saw at least at least a 1 to 2 centimeter reduction in the inflammation. By the time March, April, and May had gone by, he was already walking and trotting. Within a month after that, early May to middle of May, I was loping him. In the meantime, I was taking him down the trail. He was being eased into the normal, typical routine of our rehabilitation barn. If I had not had Lisa and the ActiVet therapy laser, it would have put me back at least a year to a year and a half. And what that looks like on paper when it comes to rehabilitating a horse is it looks like thousands of dollars. Our main focus is to get the healing done and to get the horse reclaimed, recycled, and re-performing. This laser, to summarize everything, I was back on Magnum's back within 60 days. I was loping within 90 days.